Do you have health insurance?
No. Right now I can't afford it, and I'm a student.
And you're a student? So you don't have it covered through your school?
No.
And you're studying medical care?
Yes.
And you don't have health insurance?
Correct.
Do you have health care?
I'm a veteran, so I do have VA medical. But before that, I do have like almost $2,000 worth of past due medical bills, so I don't think they'll cover that.
Were you with the military at the time when it happened?
No, I was out for about 3-4 years. I didn't know about the VA medical coverage. Come to find out, I had an honorable discharge, so I was covered. So it was like $1,000 just on my credit right now.
I do have healthcare insurance. It's through my school right now. Before that, I was paying about $150 a month for some private insurance.
It's pretty good.
Yeah, it was actually pretty decent.
Yeah.
You know, not as good as when I was working, and the COBRA policy was terrible. It's like $450 a month.
So how do you go from $450 a month to $150 a month?
Dropping certain aspects of the healthcare coverage. You know, just not as much coverage for certain, you know, for hospital stay and for emergency visits and that sort of thing.
It's called eczema. This is a severe case of it. You know, it costs $80 for the really good stuff. And you know, I can't afford $80.
Do you have health insurance?
No.
No? Do you want health insurance?
Oh, that'd be nice, but I don't really want to live off the government.
What if there was some sort of way to work that out so that you feel like you're giving back something whenever you get something?
That would be all right. That would be cool.
I'm into a health program already, and I don't think it really applies to what everybody else is into.
What kind of health program are you into?
It's HIV, and so my meds are covered through Medicare.
Okay.
And other than pulling out money from my little bit of Social Security disability, everything seems to be working fine. A lot of people, they say, oh, you always get denied 3 times. When you apply for Social Security disability, everybody gets denied. That's not right. They make it so hard for you to get on there. Well, you know.
So you got denied 3 times and now you're on
I got denied 5 times. And then I got sicker and sicker and sicker until I got to the point that they give you this line. They say, okay, once you get to this line or below it, you automatically qualify. So that's what I had to do. I had to get myself real sick to get my disability.
Every human has the right to be healthy and be protected in that respect.
I think that everybody in this country should have affordable health care. I mean, the rich can afford it, the poor can't. That's not right.
Something that's supplemented by the government, I think would really help for people like in my shoes.
I'd hope it's eventually free. I lived in Germany for a year, and I was a student and I was covered. I mean, it was great. I didn't have to worry about a thing. I paid, you know, $5 for a prescription and got to go to a doctor for free, got to go to the hospital for free when I needed to. And, you know, I'd much rather pay a bit higher in taxes than have to worry about not being able to, you know, do what I want to do because I have to pay a $50,000 hospital bill down the road.
I think we should have like healthcare like Canada's.
Socialized medicine, I don't know whether that works. It seems to be working in Canada. But I hear stories of old people going from, let's say, upstate New York or upstate on the border of Canada, going into Canada and getting their meds because the same medicine in Canada is cheaper than it is in the United States. What's up with that? I'm not paying my taxes to help support a war. I'd rather pay my taxes to help support our medicine.
On the subject of healthcare, we have an endless number of people with as many different needs, but there are overall themes. When we concentrate on what we have in common, we can get amazing things done. But if we don't speak up for ourselves and work to understand each other, someone else will speak for us. We're excited about this project because it creates community in a really cool way. You tune in to look for yourself or someone you know, and all these other people are talking about their own experiences too. Help us create a community voice that gives equal importance to both the good of ourselves and the good of everyone else. Welcome to the Community Health Project. Make your voice heard. On the subject of healthcare, we have an endless number of people with as many different needs. But there are over